Well, good morning, everyone, and welcome to Webinar Wednesdays with Senior Medicare Patrol. We're happy to have you all join us this morning. My name is Sunny Lawless, and I'm the volunteer coordinator for our SMP programs. I will be one of the presenters for today's presentation. And also joining me is Shamari Lewis, who is one of our community outreach specialists in Georgia. So today for the June installment of Webinar Wednesdays with SMP, we're going to talk about my favorite topic, volunteering for SMP. During the presentation, you're welcome to type in any questions that you might have into the chat, but we're going to hold those until the end of the presentation when we open it up for a Q&A. There will also be a prize drawing held at the end of the presentation today. You must have been registered to attend the webinar prior to 10:15 a.m. this morning in order for your name to be entered, and you have to be present to win. Now, before we get started, I do have to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award, with 100% of our funding coming from ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. For those of you who are new with us today, we want to give you some information about our program. So who is Senior Medicare Patrol? Well, SMPs are grant-funded projects, like I said, from the U.S. Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own SMP program. In Georgia, Louisiana, Mississippi, and we just recently added the state of Vermont, those SMP programs are sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Now, before I dive into our presentation, I'd like to take a quick poll. So our polling question for today is, what do you think the benefits are for older adults who volunteer? So let's see, give me 1 second. I will launch the poll. If I can find it, there we go. All right, so what do you think the benefits are for older adults who volunteer? Is it A, it's good for their mental health? B, it prevents loneliness and isolation. C, it gives them a feeling of purpose. D, it helps them learn new skills. Or E, all of the above. And I'll give everyone just a few seconds to quote. It looks like we're about 80% now, so there are a few of you who still might need to submit your answers. All right. So we're ready to close that poll and share the results. And of course, all of you voted all of the above, and that's absolutely true. So we're going to go over those benefits now. Okay, so as you suspect, there are many, many benefits of volunteering for older adults. These are just a few of them that were shared by Vantage Aging. So yes, it's good for your mental health. You know, volunteering keeps the brain active, which contributes to mental health. Meaningful and productive activities can help you feel happier and have a positive outlook on life. And it prevents loneliness and isolation. So social isolation is a major issue that many older adults face. So the feeling of loneliness and a few interactions with others can negatively impact a person's health. Getting out into the community and volunteering promotes socialization. Plus, individuals who engage in volunteering activities experience a shorter course of depression than those who do not. And yes, it also gives you a feeling of purpose. You know, as we grow older, our sense of purpose might begin to fade. Children grow up and move out of the house. We might be retiring from our jobs. And some of those physical activities that we are used to doing, they might become more difficult. So regaining a feeling of purpose through volunteering can help older adults feel recharged with a new zest for life. Volunteering can also help you meet new friends. So life changes, moving into a new neighborhood, or like we said, retiring from a career, that can help make finding friends to spend time with more difficult. Volunteering is a great way to meet new people with common interests. And by working together towards the same mission, it can help build relationships and friendships with like-minded peers. Another reason volunteering for older adults increases physical activity. Physical activity is highly important when it comes to staying healthy and independent as we get older. Volunteering keeps you moving, whether you're serving meals at a shelter, helping to clean up your local parks, or walking around the neighborhood with someone as a companion. And even volunteering for SMP also keeps you active. And it helps you learn new skills. So sometimes monotony can make life a little dull. If you find yourself bored or with too much time on your hands, volunteering might be just what you need to spice things up. Many volunteer activities allow you to try new things that you've never done before and also learn new skills. So now that you know why you should volunteer, we're going to talk about why you should volunteer for the SMP program. The SMP program offers volunteers an opportunity to make important differences in their community. Volunteers take pride in working to ensure that the Medicare program will be protected for future generations. SMP volunteers receive training on the basics of Medicare and healthcare fraud, errors, abuse, and scams. Once their training is complete, they are better aware of the scams that affect some of our most vulnerable beneficiaries. Our volunteers also participate in bi-monthly webinars and various training opportunities throughout the year. Depending on the area that you're in, sometimes you might have the opportunity to work with a fellow volunteer or a staff member even at presentations and community events. And we also hold volunteer appreciation events during the month of April for National Volunteers Week and Month. Volunteering for SMP is also a great activity for couples. You can work together with your spouse or partner to give SMP presentations and attend health fairs. As I mentioned on a previous slide, our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. There are three main areas of work for senior Medicare Patrol programs. The first and third are to conduct outreach and education and to receive beneficiary complaints. The second is to engage volunteers. And we know that protecting older persons' health, finances, and medical identity while saving precious Medicare dollars is a cause that attracts civic-minded individuals. The SMP program offers volunteers an opportunity to make an important difference in their communities. Volunteers take pride in working to ensure that the Medicare program will be protected, as we said, for future generations. Now, unfortunately, I have not received the final reports for our numbers for 2023, so these numbers are from 2022. So in 2022, the total SMP projects had a total of 5,365 active team members, and those team members conducted a little over 18,000 group outreach and education events. Now, when we say group outreach and education events, that's referring to presentations at places like senior centers and independent living facilities, and then events that we attend in the community. And those are like your health fairs or your resource fairs. Now, through those events, the SMP programs reached a little over 1 million people in 2022. In addition, we had about 250,000 individual interactions with or on behalf of a Medicare beneficiary. And an individual interaction is really just those conversations that we have beneficiaries and others about Medicare fraud, waste, and abuse. There are several ways that someone could become involved with the SMP program, and we're going to take a look at the three volunteer opportunities that we currently have available. Those are staffing exhibits, giving group presentations, and becoming a community fraud fighter and distributing information. So now we're going to look at all three. The first volunteer opportunity we'll talk about is staffing exhibits, and it's basically just as it sounds. These volunteers help by staffing tables at events like health fairs, resource fairs, and other community events. We provide all of the materials for the volunteer to use, like a tablecloth, brochures, and giveaways. And volunteers in this role go and set up a table and provide general information about SMP to the public and just answer basic questions about the program. As you can see in the photo, this is one of our Louisiana volunteers, Miss Lynn, and she's at the SMP table handing out literature and talking to the attendees about the SMP program. The second volunteer opportunity that we have available is group presentations. So these volunteers are trained by SMP to give presentations on SMP topics to small and large groups. Presentations usually last anywhere from 15 to 20 minutes, and these volunteers might interact with the audience by answering questions and through discussion. We also sometimes host bingo at sites where we give a short presentation and then we'll follow up with a few games of bingo. And of course, SMP provides all of the materials for both the presentations and the bingo, including bingo prizes if needed. Now you'll hear a sample presentation during the second half of this webinar from Shamari. It will be our standard Prevent, Detect, Report presentation, but we also have many other fraud topics for volunteers to choose from, like identity theft. The month of July, we're dedicating to durable medical equipment fraud. We also have some on understanding your Medicare summary notice or your explanation of benefits, and many more. So during orientation, volunteers receive scripts and other materials to help them as they start their journey as an SMP volunteer. Our last volunteer opportunity is for community fraud fighters or information distribution. Our community fraud fighters share information in community living settings like independent living facilities and senior housing sites. This opportunity is really done on an as-needed basis when we have materials or new materials like brochures, or if we have important fraud alerts that we need to get out there, or even just newsletters about the SMP program that need to be shared in communities. And these volunteers also might set up a table, at these facilities in the common area and just provide information to those who visit and want to ask about the SMP program. Now that you know about the types of opportunities we have for volunteers, we'll take a look, just a high level look actually, at the steps it takes to become a volunteer. The first step is an application and screening. So acceptance as a volunteer is not automatic. Because we do work with vulnerable populations, the screening process is thorough. Applicants must complete an application and a background screening. There's also a short phone interview. And the screening is basically just a criminal history background check and a motor vehicles records check. Those are the two components of the background screening that our volunteers go through. Now, once screening is complete, the applicant is approved. The second step is to complete the SMP Foundation's training and privacy and confidentiality training. These training modules are done online and they provide the volunteer with information on the program, basic information on Medicare, and information on Medicare fraud and scams. So like I said, it is completed online and there is an assessment that you have to complete once you're done. Now, after training is complete, our next step would be orientation. And we do try to make this an in-person orientation whenever possible, but sometimes just due to the areas that we're in, it's not possible and it's held virtually. This is an opportunity for me to work directly with the volunteer one-on-one to review the mission, our rights and responsibilities to the volunteer's rights and responsibilities to the program, and the code of conduct. Orientation is also when we review the procedures for how the volunteer submits information on their activities for the month, like your presentations that they gave, community events they might have attended, interaction with beneficiaries. This is whenever they report on their activities, which is done on a monthly basis. Now, this graphic shows you some of the ways that you can become involved as a volunteer. You can conduct outreach and education, complete continuing education trainings, attend and participate in our bi-monthly volunteer check-ins, attend and participate in our yearly volunteer appreciation events, and also continue to complete continuing education and screening refreshers when the time comes for you to do so. So now let's look at the time commitment. Volunteering for our program is extremely flexible and it's done on an as needed basis. As presentations and events are added to our calendar, volunteers are offered the opportunity to attend, and of course they have the option to decline if they're not available on that particular day or time. Volunteers pretty much determine how often they'd like to participate in SMP activities. So we do ask that a volunteer commit to the program for at least 1 year because, screening and training is so involved, but you guys pretty much determine how often you would like to participate. Scheduling events can sometimes be a little tricky, so I do work with the volunteers one-on-one to see what their schedule might look like for the coming month, and then work to fill in those opportunities. So basically, the volunteers will just tell me they're available on these particular dates, and those are the dates that I try to schedule opportunities for them. And of course, we also encourage volunteers to find opportunities for themselves within their own communities. And this is just a look at some of our volunteers in action at different events. As you can see, these three are working at community events where a table is set up and they're just behind it handing out our SMP literature. And sometimes you might have a staff person there with you depending on the size of the event, or there might be another volunteer there with you as well. And here are some photos from our volunteer appreciation events that were held in April to celebrate National Volunteer Month and Week. We always try to have a nice luncheon. This year we presented certificates with links of service, and also as a gift to our volunteers, they all received SMP rain jackets. So if volunteer for SMP sounds like something you would be interested in doing, this is what you need to do. These are the next steps. So you can call us at our toll-free hotline number, which is 877-272-8720. You'll speak with me and I'll answer any questions that you might have. I'll send you an information packet. Once you get that information packet, you kind of take a look at it. And if you think that volunteering for our program is a good fit for you, you would complete the application, and that kind of is what gets the ball rolling for you. So now that you know more about what volunteering for our program entails, I'm going to turn things over to Shamari, who is going to share the 3 keys to success in preventing fraud, errors, and abuse. Now, these 3 keys are tips that a volunteer would share during a typical SMP presentation. So this is just a small part of what a presentation looks like for you guys.
All right, good morning, everyone. Now we're going to go ahead and go to the next slide. Okay, the first key is prevent. You want to protect your personal information. That is your best defense against healthcare fraud and abuse. Share only your Medicare number only when necessary, such as at a doctor's office or pharmacy. Only carry your Medicare card when you know you will need to use it. Remember, Medicare will not call you to ask you for your Medicare number for any reason. Again, I'm going to repeat this again very much throughout the presentation. Medicare will not call you to ask you for your Medicare number for any reason at all. And keep a record of all of your medical visits and procedures that take place and medical equipment ordered. Next slide. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare summary notice, your MSNs, or your explanation of benefits, EOBs. Your Medicare summary notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive healthcare services. Compare your statements to your personal records and look for the following items: medical appointments you did not attend or that were double billed for, and medical equipment such as braces, catheters, or diabetic supplies that you did not order or receive. Next slide. The third and final key is report. If you suspect you have been a target of fraud, please report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious phone call, please do not give out any personal information. Report the call immediately to SMP. If you have any questions about your Medicare statements, call your healthcare provider or plan. And if you're just not comfortable calling your provider or just not satisfied with their response, call the SMP hotline at our toll-free number, 877-272-8720, that's shown on the screen. Next slide. As mentioned in the previous slides, of course, we have a toll-free number here that's on the screen that you can call to report potential healthcare fraud or to access questions about potential fraud, and even to request that we attend your event or speak to your group on our fraud prevention message. The SMP cannot be successful in fighting Medicare fraud without reports from people like yourself and inviting along others to reach older and disabled adults within the community. Additionally, if you can visit our website, which is www.stopmedicarefraud.org, for more information about the SMP program within the state. Our website can be viewed in multiple languages by adjusting the language tab at the top right part of the screen. Next slide. Want to stay updated on the latest scams impacting older adults in the community? Well, just go ahead and scan the QR code using the camera on your cell phone to be guided to our social media platforms, which include Facebook. We also have one for all of our states, Georgia, Louisiana, Mississippi, and even a Spanish Facebook page, YouTube, and our amazing podcast, Sip and Learn with SMP on Spotify and Apple Podcasts. Our state-specific SMP Facebook pages especially are great resources for older adults and their care partners to find out a little bit more information about the hot scams that are happening as soon as we learn it and report this information, and also give this information to our community partners as well. Next slide. Coming up next month for Webinar Wednesday, we will be discussing about DME fraud and scams. The webinar is scheduled for July 31st at 10:30 a.m. Central Time, 11:30 a.m. Eastern Time.
All right, thank you, Shay, for that information. So for those of you, who may be interested in volunteering or learning more, the information that Shay presented, is basically what the SMP presentations look like. We do insert information about specific types of fraud and scams, but that gives you the prevent, detect, report piece of those SMP presentations. So now it's time for our prize drawing. Everyone who registered to attend today's webinar prior to 10:15 a.m. this morning, their names have been entered into the prize wheel. And if you will just give me 1 second, I can, yeah, there we go. All right, so let's go ahead and spin the wheel and see who our winner is for this month. And you do have to be present to win. Michael M., I am not seeing him on here, so let's go ahead and remove his name and we'll give it another spin. All right, it looks like Miss Evelyn. Miss Evelyn, you are our winner today. So I will be reaching out to you to get some information. You'll get your choice of a $25 Walmart or Amazon gift card. So I'll send you an email after the webinar today, and you can let me know which one you choose. All right, so let's get back over here to our screen. There we go. All right, so before we wrap up today's presentation, I do want to open it up to questions. If you would like to raise your hand and ask us a question, you should see a little hand button in your GoToWebinar control panel, and if you click on it, it'll raise your hand and I'll be able to unmute your line and you can ask a question if you like. Let's see, Miss Vicky, you have your hand raised. Miss Vicky, I've unmuted your line. You might have to unmute your phone as well.
Got it. Can you hear me?
Yes, ma'am.
Wonderful. Hello, everyone. Well, my question is, you said that we have a lead person, Ms. Lewis, that's here in the state of Georgia. Is there a team of volunteers here that would be available to be invited to small group meetings?
Yes, we have volunteers and staff in the state of Georgia. So it just depending on, the location of those group meetings, we could figure out who's closest to you to do that.
And my next question is, would they be equipped to do a Zoom call with a small group?
Staff definitely, yes, ma'am. We could definitely make that happen with one of our staff members.
Okay, wonderful. And if you received a volunteer packet, if you already have access to a volunteer packet, that the handbook, and you just haven't completed the information, has there been any updates as of last year that would be included in a new packet that you would send out? Is there any major changes since last year?
I think there have been a few, yes, ma'am. So if you want me to send you another one, I can. We
That would
can
be
get that
wonderful.
out to you. Okay, sure.
All right, thank you.
Okay, thank you. All right, thank you, Miss Vicky, for those questions. I'm not seeing any other hands being raised, so that's going to conclude our presentation today on volunteering for SMP. You will receive an email from me after the webinar today with a link to a short survey. We would appreciate it if you would take just a few moments to complete the survey to let us know how we did today. And we appreciate you joining us again this month for Webinar Wednesdays with SMP. And I hope you all have a great rest of your week. And thank you to Shay for joining us this morning and helping me present.
No problem. Thank you, guys.